Undeniably terrible process, and I did get a chuckle out of what I saw on Fox News, which is not often the source that I quote. I don't know if you can see this, but it says unknown in new health care plan, cost, and how many lose or gain insurance. That's all we don't know, the cost and how many lose or gain insurance. That's a pretty significant hole in our understanding. And the justification for this process is often that this is what happened in 2009. That doesn't really impress me because it turns out about 57% of the 115th Congress wasn't here in 2009. So we weren't all around to have wrought that problem, and also a lot of people who on the majority side complained about that process and said they were aggrieved by it and they would never do it, and here we are doing the same thing. And there's just no justification for this. There have been hearings, yes, but the hearings have been about the Affordable Care Act, not about the bill before us. We've had no hearings about this bill. And the ranting and raving about the failures of Obamacare don't logically support the notion that this particular bill will do anything about the failings of Obamacare, whatever they may be. In fact, we would remember that before the Affordable Care Act, or since the Affordable Care Act was passed, the rate of increase in health care costs has been slower than beforehand. And the fact is we just have had no discussion, no hearings, no analysis of whether this bill before us would actually address any of the remaining issues that are left by the Affordable Care Act in some of the markets, which we would acknowledge we want to work on. In fact, that's one of the things I'd hoped we could do in a bipartisan manner. Now, in the short time since the bill was declassified, we've learned that there are a number of opponents. These opponents are significant players in our healthcare system. They include the American Hospital Association, AARP, the American Medical Association. That's just some of the groups that begin with the letter A. You know, there's a whole bunch of people who want to weigh in on this and haven't had the chance. And I'll just talk about, I was given an email from the analysis of the Blue Shield of California with a couple things that really ought to concern us all. I think those of us who are concerned about fiscal responsibility in particular. I'll read a couple. The tax credit as designed creates a cliff that creates a steep penalty for work. Republicans have criticized entitlements for creating a disincentive for work, but the tax credit as proposed creates a severe penalty for low-income people trying to move off of Medicaid. Enrollees who make just enough to move out of low-cost Medicaid would receive a tax credit that would be insufficient to purchase comparable coverage. And this is coming from Blue Shield, so they ought to know. For many of these enrollees, the higher premium and out-of-pocket costs would consume any additional income and create a negative incentive to work. Is that really what we want to do? Is that really what the majority wants to do, is in an effort to get out of entitlements, trap people in this entitlement? I don't think so. We haven't had a chance to talk about it. There's also an analysis that the tax credit that's only age-adjusted leads to inefficient federal spending, and that it's subsidizing people who can afford to buy health care and are buying health care without subsidy. That's something we ought to talk about, we ought to understand. This proposal has been called Obamacare Light because it holds on to a number of the advantages of Obamacare on your parents till 26, lifetime caps, pre-existing conditions. I guess all those things would be credited to Obamacare, despite the complaints about it. But if it's Obamacare Light, I would agree it's light on a few things. It's light on public deliberation. It's light on public funding, it's light on funding, it's light on fiscal responsibility, it's light on preventative care, it's light on mental health coverage, and it's just lightweight. And I think we can do better. I stand here willing and ready to work in a bipartisan way to really address today's market conditions in a way that would really provide more access to affordable care for all Americans. This doesn't do the job.